More discussions on the COVID vaccine tonight while so many people are scrambling to get the first dose. We hear from a doctor tonight on the potential impact of delaying the second dose of that shot.
News 3 reporter Zach Dahlheimer talked with a University of Virginia doctor who is speaking out on why it's important to stay on schedule as best you can.
We all need to be vaccinated so there's herd immunity that we can stop the pandemic.
UVA infectious diseases professor Dr. Bill Petrie has been studying the effects of COVID-19 and keeping a close eye on the two-dose messenger RNA vaccines from Pfizer and Moderna.
They're almost miraculous in their ability to protect us against COVID-19. We think that's what the second dose is doing, is to further develop the antibody response and help to make it long-term.
The CDC says the Pfizer doses should be administered 3 weeks apart, while Moderna's should be 1 month apart. However, if the recommended interval isn't possible, the agency says the second dose may be administered up to 6 weeks or 42 days after the first dose.
Under special circumstances, it's better to delay that couple of weeks than not do it at all.
Dr. Anthony Fauci says U.S. data from Moderna and Pfizer doesn't support a second dose delay.
We will go by the science, which is dictated for us the optimal way to get the 94 to 95% response, which is in fact durable for the period of time that we've been following it.
Petrie believes the second dose is crucial and the shots work best within that 3 or 4 week time frame.
Moderna did their study with 4 weeks apart. Pfizer did it with 3 weeks apart. We're kind of scared to vary from that because we know what works. And so it's kind of don't fix it if it's not broke.
While there is wiggle room, he says it's important to stay on schedule as best as possible for the best protection, especially with new variants of the virus in the U.S.
If we miss that second dose, your antibody levels are going to be a little bit lower. The more that you can adhere to the schedule, the better the chances that your antibody levels are going to be high enough to protect you even against these new variants of the coronavirus.
Zach Dahlheimer, News 3.